Evet, dün Türkiye'den bir bağlantı yapmıştık. Bugün İsveç'ten. Good morning. Can you hear us? Evet, bağlantıda mıyız?
Can you hear me?
Hi.
Hello, good morning.
Welcome to Future Healthcare Istanbul Conference.
Thank you. Pleasure to be here.
It's an honor to, see you here. And it's your turn.
Thank you so much. We have still some problems to get the slides up. I have been emailing them, so I wonder, can you see my slides?
Let's try.
This is the future healthcare, so we need to get the technique to work first.
It's always like this. We are talking about future healthcare, but we have some technical problems during 2 days. No problem. We will manage, I think. And everybody is wondering your speech. Can you share your slides, please?
I have emailed them to you because it does not want to share it for my presentation here. So I wonder if you receive them.
Okay. I am asking from technical staff to share your presentation on the stage.
Thank you.
Bağlayabiliyor muyuz Miia Hanım'ın prezentasyonunu? What time is in Sweden now?
It's 9:20, so this is perfect. Now I can see my slides. Can you see them?
I think we will.
They came up once and then they disappeared. Let me see again.
Maybe in the beginning you can tell us about Karolinska Institute. What kind of researches you are doing there, and what is the purpose of the main, institute, until we will see the slides.
Thank you. I'm very happy to do that and hope the slides will come as well. So first, thank you so much for the kind invitation. My name is Miia Kivipelto and I'm professor in clinical geriatrics at Karolinska Institute. I'm also the director for research and development for theme aging at Karolinska University Hospital and working part-time in Finland and in Geriatrist College, London. And I'm leading a big team focusing on aging and especially the brain health. And we have a lot of exciting things going on at Karolinska, where we have been building an innovative platform where we aim to integrate care, research, and development so that we can really do the top-line research and at the same time try to implement it quicker in the clinical practice. That I think has been a big challenge, that we are good in research, but it takes time to implement it. There are studies showing that it takes 15 to 20 years to implement the latest research to clinical practice. And what it comes to brain health, I think is too long time. So these are the most updates here. Now I see that my slides are also coming up. Can you see them as well?
Yes, exactly. Thank you very much. And stage is yours.
Thank you so much. And I need to say always the next slide, so apologizes for that, but I say always when we need to move to the next one. So we move directly to this one, and as I mentioned, brain health is the main focus, and especially I would like to share with you the latest findings, what we know about possibilities to prevent dementia and Alzheimer's disease with multi-domain interventions. I also want to share with you the exciting journey we have started when we are moving from the finger trial, which I have been leading at Karolinska, to worldwide fingers. How can we use new technologies for brain health and in prevention, and also what are the future directions? Next slide, you see a little bit the vision, what I'm thinking should be good for all of us. Healthy brain aging. I think healthy brain aging is really, as we all know, important for independent living, but it's also important for the development of our societies in the future. Our brain is really our future. We know that we are living longer in many societies worldwide. This is fantastic, and this is really the consequence of many good developments in the society and in the medical field. You know that there are these sayings that 80 is the new 60. 80-year-old persons today are in many societies like persons who were 60 some years back. But we have one issue, and that comes on the next slide. Brain is often the weakest link when we are getting older. All brain-related disorders are getting more common when we are getting older, and that's why I really believe that we should have this approach, focusing on brain health through the whole life course. And prevention here, I think, is very important. So I normally say it's never too early to start to prevent brain-related disorders, but it's never too late either. We can always do something to increase the brain health. And here we have fantastic new research, especially when it comes to the brain plasticity. Meaning that everything what we are doing, our lifestyle is affecting both the function and the structure of the brain. And this brain plasticity is still there when we are getting older, opening fantastic ways to affect the brain health, even an older person. So the next slide, what can we do? Dementia is, I would say, one of the main brain disorders. It's really a global public health challenge. I hope you can see the numbers here. Every 3 seconds, someone in the world is developing dementia. Today, we have around 50 million persons with dementia. 2050, the number is closer to 130 or 40 million. So we can really talk about dementia epidemic. And as you can see here, the fastest increase is happening in low middle income countries because the populations are aging globally. So this is really a global epidemic. When we are talking about aging, there are also some attitudes still there. For example, there is a lot of stigma around dementia. In many countries, the healthcare system is not yet ready. The readiness is not there. When it comes to, for example, training the persons working with dementia, both at the primary care, but also at the memory clinics, the specialized settings. And this is, of course, affecting these possibilities. On the next slide, you see some other attitudes which were there in the Alzheimer's disease international survey. 2 in 3 people still think that dementia is part of normal aging. It's not the brain disorder, but it's normal aging. And that, of course, affects the possibilities to prevent and make an early diagnosis. 62% of healthcare practitioners are believing that dementia is part of normal aging. So it's not only laypersons, but even we who are working within the healthcare. And still 1 in 4 people that there is nothing we can do to prevent dementia. So my question to you is this true? On next slide, you can see something what I think is the positive news. The latest reports are showing that 40% of dementia is linked to modifiable risk factors, which you can see here. There are diabetes, high blood pressure, and obesity already at midlife, physical inactivity, depression, smoking, low education, hearing loss. This is one of the newest risk factors. Traumatic brain injury, high alcohol consumption, social isolation, and even air pollution. And I think this is a fantastic news. There are several possible targets and time windows for the intervention. So there is clearly a prevention potential. On the next slide, you see if we turn the discussion from risk factors to protective factors, what can we do to reduce the risk of cognitive impairment and dementia? And here we have, of course, the healthy diet, education, increasing the education on the population level, and all these activities, physical, mental, and social. On the next slide, we see that this list is probably not the final. We are studying even other risk factors not listed on these previous 12 factor list point, which I showed previously. For example, not only depression, but also feelings of loneliness and hopelessness. I would say that these have been very important, especially during the pandemic, when many, especially older people, have been locked down and not able to meet other persons. I see a lot at Karolinska, at our memory clinic. We have a younger population, younger persons with stress-related symptoms and sleeping disturbances. These are also risk factors for dementia and even Alzheimer's disease. Impaired oral health, this could be linked to dementia through inflammation or less optimal diet. And then infections. There is, of course, a lot of studies going on trying to understand if COVID-19 infection can also increase the risk of dementia. So clearly, keep this in mind that the list of risk factors is still changing, and I strongly believe that there may be even other new modifiable risk factors in the future. Next slide shows where we are with the evidence. I have been working closely with WHO with the risk reduction guidelines of cognitive decline and dementia, which were launched 2019. It's an important document because it gives a strong basis for the implementation for healthcare workers and societies, and it's a clear message. We should go from research to implementation, and we should be ambitious when it comes to prevention. So really actions are needed. This document also highlighted that the new evidence is coming all the time, and especially the importance of multi-domain interventions, which I will explain to you after a while. Next slide shows the question what often comes if we are working in different settings at healthcare. How can we find these at-risk persons, and how can we assess the risk and prevention potential? Dementia is a long process. We know that the changes in the brain leading to Alzheimer's dementia may start to develop 20 to 30 years before we can do dementia diagnosis. And that's why, as I mentioned earlier, I believe it's never too early to start to prevent dementia. And now we are not only focusing on those persons who are coming to us to the memory clinic, but we want to start even earlier to really have an effective preventive effect. So we could focus on persons at memory clinic using, for example, neuroimaging, CSF, like we do in Sweden, and in the future, even blood-based biomarkers. There is a great promise in the Alzheimer field that we can detect some of these Alzheimer-related biomarkers from the blood. And that would be, of course, much easier to do a blood test compared to CSF. If we are thinking more the other clinics, not memory clinics, but more at the GP level or other clinics, so we can also focus on modifiable risk factors, trying to identify persons who have these modifiable risk factors and thinking that these persons have an increased risk to develop dementia in the future. And this could be done with these risk scores, and I think in the future also using digital tests. On next slide, we are moving then to this finger trial, I believe. Yes. And why finger trial was so important, I started the trial more than 10 years ago, is that it's a randomized control trial, and for the first time showing that it is possible to prevent cognitive decline among at-risk elderly persons from general population with the multi-based intervention. So we selected the persons using the dementia risk score, which you can see here. Persons had at least some modifiable risk factors. It could be high blood pressure and high cholesterol or low physical activity. And we had a 2-year trial, one group receiving the lifestyle-based intervention and other was receiving regular health advice, what we get today. On the next slide, you can see more closely the 5 fingers, what we used in this trial. As said, it was for the first time targeting several risk factors at the same time, not only focusing on one of those. So it's easy to remember, the finger intervention is like 1 hand and 5 fingers. Healthy, balanced diet, exercise, we had both aerobic, strength and balance training, cognitive training, using brain, social activities, and taking care of all vascular and metabolic risk factors like obesity, high blood pressure, cholesterol, and glucose. And on the next slide, if you think, what was the effect of that? First, the participants really liked the intervention, meeting the healthcare professionals who had the expertise for these different fingers and meeting each other. The social component of the intervention was very important. Adherence was high and no adverse events, only adverse events there was some muscle pain after the training, and that I think is part of the intervention. What do you think about the results? Can we see some effect on memory and cognition? That's something we can see on the next slide. Here you can see the beneficial effects of this finger intervention on cognition. Clear effect on global cognition, different cognitive domains, as you see here, 25% more improvement in this intervention group. And we see the same pattern for all cognitive subdomains. Executive function, how we are doing different type of planning, 83% more improvement. Processing speed, how quickly we can do different tasks, 150% more improvement. And even memory, 40% more improvement. So this is not only to prevent dementia, these are cognitive skills we all need in daily activities. On top of that, as you can see on the next slide, there were other health benefits. 30% lower risk of functional decline, improvements in mobility, better health-related quality of life, and these are very important outcomes for the elderly persons. Quite strikingly, 60% lower risk of other chronic diseases, multi-morbidity. And clearly, this is showing to us that behind many chronic diseases are partly same risk factors and mechanisms. We are talking about integrated interventions. We could also see 20% lower risk of hospitalization and clear health economic benefits. So we can say that this package, finger package, can have benefit both on individual level and also on societal level. On the next slide, we can see what has happened after we have published the finger trial. We have been moving on to establish the worldwide fingers because there has been need to test and optimize the finger intervention in different countries and in different settings. I normally say one size does not fit all. We have the model, but we should adapt it to different communities and different cultures so that it's sustainable and feasible. And I'm very happy that today 2021, we are having 40 countries from all continents who are part of the Worldwide Fingers Network, including Turkey. Of course, the COVID pandemic has been a challenge, and that's why we have been focusing on the COVID-related challenges. And here you can see 2 key publications if you want to study more about this issue. On the next slide, we can see a bit more what the pandemic has been doing for the risk factors for the brain health. These are results from Finland during the first phase of the COVID pandemic. And you can see that there has been a clear negative impact on many lifestyle-related risk factors already at that time. Decrease in physical activity, more loneliness, people felt that memory has been getting worse, and a lot of cancellations in dental health care and other type of services. Luckily, people were able to use more digital tools, which I think is the promise for the future. We may try to use these tools in the future to support in the implementation and interventions. On the next slide, we can see some of these tools we are using today at Karolinska and in the Worldwide Fingers. And I believe that new technology can really facilitate early detection, monitoring, and effective and feasible intervention and implementation. We can use different kind of apps or web-based interventions. Here you can see also eye track, which we are using at our memory clinic, not only monitoring the cognitive scales, but also behavior. And also machine learning, artificial intelligence, clinical decision support, that we can collect all the data and try to package it in a good way. On the next slide, you can see a bit more about these examples. This is the RiskScore app, and I think that would be good if we can use not only paper and pen, but even app, so persons can really fill in this quite easy in information. What are the modifiable risk factors, and see the profile, visualize that. What is my risk of developing dementia, and what can I do if I manage to reduce the risk? Next slide is a step further. This is the machine learning part. Can we take other type of intervention, even genetic information, memory test, and do kind of disease fingerprint that can give more tailored intervention? This is still work in progress, but I believe these kind of tools can also be implemented in the close future. And the next slide is also how we are moving from the finger, taking this to the memory clinic. We have very first results from this feasibility study when we took the finger model to the patients who are coming to our memory clinic at Karolinska with very good feasibility results. Both the recruitment rate, retention rate, and compliance was very good, meaning that this model can be also implemented to our patients. On the next slide, you see some more of these new digital tools we are using at Karolinska when we are measuring the effect of the intervention. Not only asking people how much physical activity you have been doing, but you can use the actigraph. You can measure the body composition using this nice scale that is there, so that you can really see how much fat, how much muscle these people are having. So we are having new tools to take a more accurate measure of these type of body-brain connection measures. And I have some more slides left to really put this all together. On the next one, you can see the final step where I think we are now moving. Can we package both the visual, the cognitive, and different kind of scales? And this is a study ongoing at Karolinska where we are also measuring the heart rate, the gaits, the visual things, and trying to even capture the non-cognitive, non-verbal part of the behavior. On the next slide, you see what it could lead to, kind of a social robot that could support us in this early detection of Alzheimer's disease. I don't think this robot can replace psychologists and doctors, but it can definitely support in the early detection. And on the next slide is our memory clinic, which I already explained to you when we were waiting my slides. So this is just a summary what we have been building at Karolinska. And I'm very proud for the structure where we have, as I mentioned, been able to integrate the research, care and development so that basically all patients who are coming to us are part of the research, and we try to test and implement these new kind of intervention tools and new technologies. And then I go to my summary. Prevention is better than treatment. This is what I would like to leave to you. We should start early when it comes to brain disorders, and I'm very optimistic for the future. We can at least reduce the risk of dementia, and I believe that more than 40% of dementia is related to factors we can influence and affect. On the next slide, I think this could be our mission. What can we do? And we all can do something to promote healthy brain aging throughout the whole life course and really go from the research to personalized interventions and clinical practice. So here all hands and fingers are needed. And finally, I have the take-home action points, which I hope you can take with you. Can dementia and Alzheimer's disease be prevented? I would say the answer is yes. A significant part of cases can be prevented or at least delayed. And here is this multi-domain finger model is important. It is feasible and effective and is now adapted and optimized globally in different settings. New technologies, e-fingers, I really think can help, but I don't think it can replace or take away the human contact. I think some kind of hybrid model where we have both face-to-face and e-fingers is the future. And in the future, we are moving from the complexity to precision prevention, tailoring the interventions for specific at-risk profiles. And I also believe for the combination, combining lifestyle with disease-modifying drugs and e-fingers concepts. So there are a lot of opportunities for exciting research in the future. At the end, I want to thank all my colleagues and funding organizations, and then I want to thank you for listening.
Thank you, Professor. We lost the connection.
I'm still here. I can hear you.
Thank you for your great presentation. It was a pleasure to hear you in the Future Healthcare Conference. And this conference is a hybrid, as you know. And I heard from my colleagues, and more than 7,000 people watched online your presentation. Thank you for your contribution and everything. Thank you so much.
Thank you. Pleasure to join and have a lovely meeting.